Hello everyone, welcome back. In this section, we will talk about nomenclature and classification of neoplasms. It's important to grasp the naming rules for neoplasms because it's the language by which the nature and significance of tumors are characterized. After this section, students should be able to describe the principle for tumor nomenclature. The nomenclature and classification of tumors have developed from close morphologic, histologic, and behavioral observation. Ideally, the name given to a tumor should convey information about the cell of origin and the likely behavior. In general, benign neoplasms are designated by adding the suffix "oma" to the cell type from which the tumor arises. Benign mesenchymal tumors exhibit striking similarity to their tissue of origin. For this reason, the names of these tumors are straightforward and include the tissue of origin with the suffix "oma." These tumors grow slowly and can become very large. The most common form is a leiomyoma, a benign tumor showing smooth muscle differentiation, often occurring in the uterine muscle. The nomenclature of benign epithelial neoplasms is more complex. They are classified sometimes on the basis of their microscopic pattern and sometimes based on the macroscopic appearance. Others are grouped by their cells of origin. For example, the term adenoma is applied to benign epithelial tumors producing glandular patterns and to neoplasms derived from glands, but not necessarily showing glandular arrangement. This is often prefixed by the tissue of origin. For example, thyroid adenoma. Cystadenoma are hollow cystic masses. Typically, they are seen in the ovary. Papillomas are benign epithelial tumors growing on any surface that produce microscopic or macroscopic finger-like fronds. A polyp is a mass projecting above a mucosal surface, as in the gut, to form a visible structure. This picture shows a colonic polyp projecting into the colonic lumen and is attached to the mucosa by a distinct stalk. Although this term is often used for benign tumors, some malignant neoplasms may also appear as polypoid. The naming of malignant tumors essentially follows that of benign ones, with certain additions and exceptions. A malignant tumor of any epithelial origin is called a carcinoma. It must be remembered that the epithelia of the body are derived from all three germ cell layers. A malignant tumor arising in the renal tubular epithelium is a carcinoma, as are the malignancies developed in the skin and lining epithelium of the gut. Carcinomas are the most common type of malignant tumor in humans. They fall into several different subtypes, depending on the differentiation that they show. Carcinomas of surface glandular epithelia, such as stomach and colon, showing a glandular pattern, are called adenocarcinomas. The same is true for carcinomas arising in solid glandular tissues, such as kidney, breast, prostate, and liver. Carcinomas of glandular epithelia are termed adenocarcinomas, and those which produce squamous cells are called squamous cell carcinoma. To classify a carcinoma further, we often add the tissue of origin, for example, adenocarcinoma of the colon and squamous cell carcinoma of the skin. Other forms of carcinoma include hepatocellular carcinoma and basal cell carcinoma. Sometimes, the tumor shows little or no differentiation and must be called poorly differentiated or undifferentiated carcinoma. Because of the fleshy appearance of its cut surface, a malignant tumor of mesenchymal tissue is a sarcoma. These tumors are far less common than carcinomas, but they grow rapidly with extensive tissue destruction and produce primarily hematogenic metastases. Most of them are found within the deep soft tissue of the limbs and trunk, although some arise within viscera. Sarcomas are designated by their histogenesis. For example, leiomyosarcoma is a malignant tumor showing smooth muscle differentiation. Rhabdomyosarcomas display skeletal muscle differentiation and mostly occur during childhood. However, there are some exceptions to the general rules given above. Some terms with a suffix -oma are used for malignant tumors. According to the conventions above, lymphoma ought to be a benign tumor of lymphocytes. A lymphoma, however, is a malignant neoplasm of lymphocytes. Similarly, we have seminoma, dysgeminoma, and melanoma. Please note that leukemia is the term used for cancer of hematopoietic cells, and it rarely forms a tumor mass. Some malignant neoplasms are given the name of an individual who discovered them. For example, Hodgkin's disease is a special type of lymphoma. As discussed earlier, neoplasms are of monoclonal origin. However, in some instances, tumor cells may undergo divergent differentiation, creating so-called mixed tumors. For example, adenosquamous carcinoma is the combination of adenocarcinoma and squamous cell carcinoma. Carcinosarcoma is the rare combination of malignant tumor of the epithelium and mesenchymal tissue. Fibroadenoma of the female breast is another common mixed tumor. This benign neoplasm contains a mixture of proliferated ductal elements embedded in a loose fibrous tissue. Although studies suggest that only the fibrous component is neoplastic, the term fibroadenoma remains in common usage. A teratoma contains a mixture of various tissue types arising from totipotent cells derived from the free germ cell layers. Most common sites for teratomas are ovaries and testes. The tumors consist of a mixture of tissue at varying stages of differentiation, from the most undifferentiated embryonic tissue to the most mature adult type, such as skin and its appendages, teeth, digits. Teratomas may be benign or malignant. The former tends to be mostly cystic and composed of mature and adult type tissue, whereas the latter tends to be solid and may continue to proliferate at the embryonic level, producing tissues of all degrees of immaturity. Blastomas or embryomas are a group of tumors arising from embryonic or immature tissue or nervous tissue. Although the name suggests this may be a benign neoplasm, most of them are in fact highly malignant tumors. These tumors occur more often in infants and children. Examples are medulloblastoma, retinoblastoma, and nephroblastoma. However, osteoblastoma is an exception. It is a benign neoplasm. There are other instances of confusing terminology. Hematoma is a mass of mature but disorganized tissues indigenous to the particular organ. For example, hematoma of the lung consists of mature cartilage, smooth muscle, and epithelium. Thus, all mature differentiated tissue elements which comprise the bronchus are present, but are jumbled up as a mass. Hematomas have traditionally been considered developmental malformations, but some genetic studies have shown the presence of acquired translocations, suggesting a neoplastic origin. Cholestoma is the name given to the ectopic islands of normal tissue. Thus, cholestoma is a heterotopia but is not a true tumor. For example, a small nodule of well-developed and normally organized pancreatic tissue may be found in the submucosa of the stomach or duodenum. Tumors are named with suffix "oma" to denote benign tumors. Malignant tumors of epithelial origin are called carcinomas, while malignant mesenchymal neoplasms are named sarcomas. A few examples of combination of tumors are mixed tumors, including teratoma and blastoma. Currently, tumor classification is based on the histogenesis and the anticipated biologic behavior. This slide lists the nomenclature and classification of common neoplasms. Alright, that's all for this section. These are the references. Thank you.